Hey there, I'm Alley Cat. Today I want to talk about a guy I saw on YouTube Shorts named SteveIOE, aka SteveIOE. Now before we get into it, I just want to say that I'm not trying to cancel this guy. I don't think I could even if I wanted to. The man has about 2.5 million subscribers, and I don't think I'm gonna make a dent in that. Rather, I want to use him as an example of a mindset that leads to a lot of problems in healthcare work and results in people with legitimate problems either being refused care or refusing to get care themselves. My best case scenario is that people will see this guy as an example of what not to do when you work in and around healthcare. Personally, I have nothing against Steve. I could probably find examples of this kind of stuff in pretty much any medical drama, but the benefit of stuff like TikTok and YouTube Shorts is that they make things very short and concise and therefore easy to use as examples. If you see anyone in the comments trying to say I hate him or I'm just jealous, don't actually respond, just reply with a clown emoji. They didn't actually take the time to watch this video, so you should put just as little effort into your response. Anyway, let's start with, I think, the second video I ever saw of his. I'll play the whole thing because it's pretty short, and I want to make sure nothing gets taken out of context.
Hey Rich, can you discharge Bed 2? The guy who's here for pain meds? I'm not gonna give him any. It's the third time this week he's been here for the same thing. Can you just discharge him? Okay, I'll try. Alright sir, the doctor's all done. You're free to go. But I didn't get my medication yet. We're not gonna give you narcotics, man. Sorry. This is bullshit! I waited! You better get me my meds, asshole! Sir, please don't make this harder than it has to be. I want to talk to the doctor. He's not coming back. I'm not leaving until I talk to the doctor. The doctor has discharged you. He's moved on to other patients. I'm not discharged! I'll discharge on you, motherfucker! Patient was informed he is discharged. Patient became agitated and states, quote, "You are all assholes, and someone better get me some fucking meds," end quote. Patient is also threatening to discharge on staff. Security notified, and patient was advised against discharging on anyone or anything. We'll continue to monitor.
So you might be thinking, well, that patient was obviously being unreasonable. But you have to understand that this is intended to be a comedy skit. It's not something that actually happened, it's someone's recollection of something that may or may not have happened, which is subject to their biases and personal views. Think of it from the patient's perspective. If you haven't experienced it yourself, you probably at least know or have heard of someone being turned away with legitimate pain for being drug-seeking. The guy's apparently come in 3 times this week for pain, so there's obviously something wrong with him, and he's being turned away with no help. That'd definitely make me angry, and a tech getting all passive-aggressive with me would not be helping at all. The opioid crisis is not the focus of this video, so I won't get into it too much, but one of its effects was that doctors started to prescribe pain medication for any type of pain without bothering to figure out what was wrong. When medical institutions started to crack down on opiate prescriptions, doctors just stopped even prescribing pain meds. The care didn't get any better, but the prescription rate went down, and that was the main concern, right? As someone with chronic pain, the amount of times a doctor has done a physical examination and just turned me away because they couldn't find anything wrong may shock and astound you. It took me at least a decade to finally get my diagnosis, and it was only because I researched the tests I needed and asked for them specifically. If you look at the comments on this very video, you'll see dozens of similar or even worse stories. Videos like this contribute to a perception of people who come to a clinic as being unreasonable, violent addicts who just want to fix. The reality is that most addicts don't even get their opiates from doctors anymore. A 2017 study found that only 25% of those who misused prescription opiates obtained them through a legitimate prescription. There's no study on this that I can find, but I'm willing to bet that more people with legitimate problems get turned away for drug-seeking behavior than people who are actually seeking drugs. Even if a patient is an addict, the ER is at least a safe, clean place to get a fix, where a doctor can monitor them and their dosage. Turning away an addict isn't going to stop them from getting drugs, it's just going to encourage them to turn to other, more dangerous methods of relief. Experts tend to agree that the war on drugs and its zero-tolerance policies have been an utter failure. Harm reduction is becoming a much more widely accepted method of treating addiction, and it's views like those expressed in this video that are stopping addicts from getting the help they need. Just please try to use some empathy. No one comes to the ER if they don't legitimately believe they need help. Talking down to them doesn't solve anything. Alright, next video.
Hi, ma'am. The doctor ordered you some saline. I'm gonna give it to you through an IV. No, I already told the doctor I don't take medicine. Oh, well, this is not really medicine. It's fluids, like water, to help you hydrate. I'm allergic to that. Are you sure? Yes. You're allergic to water and a little salt? Yes. Are you also allergic to your own blood, sweat, and tears? Because kind of all made up the same thing. Excuse me? I mean, if you're gonna refuse everything we offer, why even show up to the ER, right? Patient refuses saline. Patient states she is allergic to saline. Patient also states that staff is incompetent and she would like a new nurse. We'll continue to monitor.
So here we see another biased view, someone complaining about being allergic to something in the saline solution. Despite what Steve says in the video, saline bags can have additives in them that people can be allergic to. Also, people can be allergic to chemicals and the disinfectants used in hospital settings, and may not present symptoms until trace amounts of those disinfectants enter their bloodstreams via a saline IV. Some people are just sensitive to new things entering their body. It's almost like human bodies are incredibly complicated organisms, and there's a reason why people have to go to medical school for years just to learn like 10% of how they work and where they can go wrong. Writing off allergies by thinking, well, nobody could be allergic to that, leads to people going into anaphylaxis because a doctor ignored their reported allergies. It happens more often than you'd think. Again, the comments on this video are full of examples. Next video. Let's see if you can pick up on the theme.
Has anybody ever been to the ER here? You have? Recently?
Last year?
Last year. Okay, we're gonna play a game. Is it an emergency?
It was an ear infection.
It was an ear infection. Hold on. Was it? You said it was an ear infection. Hold on. Give her a chance. What happened?
Vertigo.
It was vertigo?
And then...
Hey, man. What time was it?
Like 8 in the morning.
It was 8 in the morning.
I didn't go to the ER until the nighttime.
You didn't go to the ER until the nighttime?
Because I was like, I'll just brush it off. I'll just wait till we go home or something.
Okay. Did you have to work that day?
I was on vacation.
You were on vacation. What country? Hawaii.
In Oahu.
In Oahu. And how's the waiting rooms in Oahu?
Wonderful.
Really?
Yeah. Walked right in.
And then?
And then I was out of there within an hour.
Because nothing was wrong with you.
Yeah, as someone with a chronic health condition, hearing a medical professional say nothing is wrong with you is probably one of the most infuriating things ever. Some of my problem with this video comes from my personal bias, but part of it also comes from the fact that this kind of thing contributes to a culture where people are unwilling to seek medical attention for minor issues until they become major life-threatening problems. And even then, they still may refuse care. The woman in the video was on vacation in another state, so she probably couldn't just go to a regular clinic. She was willing to wait all day to see if it would go away on its own, and it obviously didn't. She went to the one place she knew for a fact she could get care. And Steve just told her, yeah, you shouldn't have done that. Okay, then what should she have done? I'm serious, this is a legitimate question. One that he, of course, does not answer, because he's not actually a medical professional explaining things. He's a comedian making jokes. Oh, and by the way, getting on a plane with an ear infection can be very painful and can even lead to ruptured eardrums. So, you know, not great. Let's look at a video where he does try to explain things. Just as a heads up, this one's a little longer and I'm not gonna sugarcoat it. He makes light of sexual assault in it. If you think this might trigger you, skip to here.
Tips from the ER. Pelvic exams. Ladies, you got a lot going on downstairs. It's not uncommon for you to come to the ER for an emergency pelvic exam. Whether it's for unusual pain, abnormal bleeding, or you're leaking something funky because your new partner has an STD and they didn't tell you about it. That lying slut-faced son of a bitch. First thing we're gonna do, strip you down to a hospital gown and get you onto one of our special GYN beds. That's the bed with the 2 feet holders to keep your knees up and out of the way. We need a clear shot of the hole, motherfuckers. The doctor will then feel around, check you inside, outside, and stick a speculum into you to keep you open long enough for a quick swab. There's usually a third person in the room to chaperone the exam. This is for the benefit of both parties. Just in case the patient is crazy and says the doctor tickled them somewhere they didn't want to be tickled, or in case the doctor's crazy and tickles the patient somewhere they didn't want to be tickled. We'll never know unless there's a witness in the room to tell the judge they both tickled each other and liked it.
So, another YouTuber named Footless Jo made a video about this and another video of his that's very good, and I recommend you watch it. Link in the description. I apologize in advance if I end up reusing any of her points. It's not intentional. Jo comes at this from the perspective of someone who needed to go in for a pelvic exam, saw this video, and got anxious about it. I can't relate to that part because I've never had a vagina, but as someone who presents feminine on a daily basis and has faced sexual harassment on multiple occasions, I can say this definitely makes me uncomfortable at the very least. I don't care about the swearing, and I'm not one of those people who thinks that there are things you can never joke about ever. But when it comes to jokes about certain topics, you have to have a certain tact that just does not come across in this video. Saying the doctors are going to strip you down makes it seem like they're actually going to undress you themselves. I can absolutely see why this might make someone nervous coming from someone dressed in scrubs. Doctors will never undress you unless you physically cannot do it yourself, and even then, they'll get your consent as long as you're conscious. They will not strip you down for a pelvic exam. They will ask you to change into a medical gown and give you some privacy while you do so. On top of that, referring to the very serious topic of medical sexual assault as both of them tickling each other and liking it reveals a pretty concerning bias against victims, seeing as how actually they wanted it is a common defense against allegations of assault. Medical sexual assault does happen, and if it's just a patient's word against the doctor's, most of the time the doctor wins because they carry more respect. You are always allowed to have a third party in the room during any medical procedure or exam, and you are allowed to end the exam at any time if you feel uncomfortable. I know Steve is trying to ease anxiety with humor, but these kinds of explanations just end up causing more problems than they solve. Anyway, he's got some more videos that I kind of wanted to talk about, but they're honestly just more of the same. I think I've already gotten my point across. If you work in healthcare, it's really important to take each patient as they are and not let your personal biases get in the way of treatment. Treat people with respect. You might think they're wasting your time, but to them, it could be one of the worst experiences they've ever had. Especially once they see the bill. Let's end this analysis on a positive note. I don't want to make it seem like this guy is Bad Take City. There are a few videos I've seen from him that are actually pretty good. Let's watch one.
I was at the park and I fell on my wrist. Oh yeah, it definitely looks broken. It's a good thing you came in. I'm also having some pain in my chest. We'll get you an EKG and draw some blood for labs. We'll figure this out. You're gonna draw my blood? Yep. Will drugs and alcohol show up? Yes. Did you take anything? I have to go. Wait, but you have a broken wrist. Ah, oh no. Okay, I had some alcohol and I smoked a joint. Please don't call the cops. Why would I call the cops? Because I'm only 19, it's illegal. No, it's okay, we're not gonna call the cops, even if it shows up in your blood work. We just wanna make sure you're okay. Are you gonna call my parents? Not unless you want us to. You don't send home the lab results? No, trust me, it's gonna be okay. We're gonna take care of you. Okay, thanks, Austin. But also, no more drugs and alcohol! Yes, sir.
This is good, accurate information delivered with compassion and a little humor. Hospitals won't call the cops on you even if your blood work shows illegal drugs. He uses underage alcohol and weed as examples, but even if you show up on meth or heroin, they won't call the police. It's good information to know since people might hesitate to go to the ER if they think they might get arrested. He also has videos showing that hospitals won't call the cops even if you've been shot or stabbed. This is also true, although it varies from state to state since some states require hospitals to release gun violence information. All in all, very good stuff. Next video.
101.8. Yep, he's got a fever. Poor thing. I knew it. Never doubt a mother's instincts. Never do. Were you able to give him any Tylenol or Motrin before you came in? No, I wanted you to see the fever. Why? I didn't want you to think I was crazy bringing my kid here without a fever. I don't want to be one of those moms that brings their child to the ER for no reason. Ma'am, I promise you, if you tell us your kid has a fever, we will believe you. But for the future, if you want to save us both some time, go ahead and give him a dose of the Tylenol or Motrin before you come in, as long as you know he has a fever. Really? Yes, of course. It gets your kids feeling better and it lets us see how they respond to the meds. That makes sense. You know, even better, if you give the meds at home and he starts to look great afterward, it might even save you a trip to the ER at 2 a.m. I will. Thanks, Rich. No problem. Now, come on. Let's get your kid feeling better.
Again, accurate information, obviously given with compassion. I hope including these videos shows that I don't have anything against Steve himself or even his style of video. I just think that some of the views he expresses showcase a larger problem when it comes to the mindset of healthcare workers. There's an overall tendency to look down on patients and treat them like unruly customers at a grocery store. But healthcare workers have a lot of power over their patients, and making fun of them just ends up feeling like punching down on people who don't really deserve it. I want to leave you with a couple people I think do this style of video a lot better. First up is a YouTube channel called Fire Department Chronicles. This guy is a firefighter, and if you didn't know, a lot of times firefighters often work as paramedics. He makes a lot of skit videos dramatizing real calls he's been on, and they're funny without being overly degrading towards patients, especially since they show that paramedics are just as human as the rest of us.
Hey, doing a fire rescue? Somebody called for a car accident? Hey, my moron brother over here just got his leg rearranged. Oh, God. Oh, I was just resting my leg out the window, and the car came by too close, and all of a sudden I knew exactly what the bottom of my foot looked like. That's not good, man. Yeah, it's not good. I've been telling him for years to stop putting his foot fungus-filled feet out the window, and now look what happened. You think right now is the time to lecture me when my leg has a new knee? All right, man, what do you want to do? I'm going to go throw open that bush over there, and then we'll go from there.
The other one is Dr. Glaucom. The other one is Dr. Glaucom Flecken. His videos aren't as short and focus more on doctor-to-doctor interaction rather than doctor-to-patient, but he's still a pretty good example of how to do medical comedy without unfairly degrading patients.
All right, go ahead. What do you got? We got a 68-year-old farmer. He was building a fence and started noticing some back pain. Did his wife make him come in? No, he came by himself. He's alone? Yeah, he was worried, so he came right in. Hey, Peggy, wake up. We got a farmer who came in voluntarily. What else did he say? Well, I asked him to rate his pain on a scale from 1 to 10, and he just said, I'm here, ain't I? What? Yeah, that's all he said. I don't know what that means, though. That's because you're using a pain scale for normal people. You got to use the farmer pain scale. Is he going to be okay? Listen to me carefully. Did he finish the fence? No, he had to stop. Dear God. Peggy, get the crash sack ready. It's going down. What's a crash sack? Well, we had a crash cart, but we had to repurpose it as a hospital bed, so we just stuffed everything into a burlap sack. Hey, Doc, Jim Bob's on the phone. He cut his hand. He thinks it's infected. Hey, I don't have time for this. I got a farmer here who quit chores to seek medical care. Well, he's been using Delilah's antibiotics. She had mastitis last year. He just wants a refill. Is Delilah his wife? No, it's his dairy cow. Can you call Leroy with this? I got a situation over here. I tried. He's in the middle of a root canal. Leroy is the dentist? He's the dentist and the pharmacist. Hey, Peggy, can you tell Texaco Mike to go ahead and gas up the fan boat, please? Is Leroy a pharmacist for humans or animals? You think we have 2 pharmacists here? Yeah, go ahead and fax him. It might take him a while to get here. Hey, Doc, Jim Bob called back. He said never mind. Well, great. What? What's wrong? When a farmer calls asking for help, you got to jump on it right away. If you wait too long, he'll say to hell with it and you'll never hear from him again. Really? Hey, what did Jim Bob say when he called? He said to hell with it.
In summary, I think there are definitely issues with the way some healthcare workers see patients that lead to a lot of unfair discrimination, and some of Steve's videos highlight that. I don't have a problem with him as a person or his videos as a whole, or even medical comedy videos. I'm just using these to highlight a certain mindset that I believe is harmful, and suggest alternatives that are less so. Thanks for watching. This definitely isn't going to be the only video of its kind on this channel, so if you like it, feel free to subscribe or support us on Patreon. If you have a perspective on this topic you think might be interesting, let me know in the comments. I'm especially interested to hear from people who have worked in an ER before or know someone who has. I may even make a follow-up video if I get enough new information to warrant one. Anyway, I hope at the very least you learned something from watching this video. Have a great day.
Alley Cat Blues.
Hang on a second, nurse. What we should probably use is marijuana. That'll sufficiently sedate the patient for surgery. Marijuana? But why?